Sarcomas.
Many people ask, what is sarcoma if someone in the family is stricken with this disease? Now, first and foremost, sarcoma is not one disease. There are hundreds of different diseases that are grouped under the general term sarcoma. Sarcoma refers to a growth of cells whose normal function would be to hold the body together. These are called connective tissue cells because they're connecting different parts of the body. And generally speaking, these include cells like muscle, bone, nerves, and other things that don't really have a function in the body other than to hold it together. Any one of these different kinds of cells, fat cells, muscle cells, different types of nerve or nerve protecting cells, blood vessel cells, if they turn cancerous, that type of a cancer is known as a sarcoma. Now, importantly, the different types of sarcomas have more complicated names. So a muscle sarcoma could be either a rhabdomyosarcoma or a leiomyosarcoma. These polysyllabic nightmares are difficult for patients to understand. They're very difficult for physicians to understand unless they are sarcoma experts. And frankly, it's been very confusing in the field of medical research. And part of what our team is trying to do with expert pathologists like Chris Fletcher at the Brigham and Women's Hospital is to try to make these different sarcomas actually different diseases that we treat in different ways. The analogy is simple. If you get an infection, you try to figure out what bug is causing the infection, and then the doctors can treat that specific bug. It's exactly the same with sarcomas. If a patient or a loved one gets a sarcoma, you want to be sure you're getting the exact right type of treatment for that exact right type of sarcoma. Part of what our team here is focused on is understanding all the different types of sarcomas in as much detail as we can, right down to the level of the DNA. Because sometimes, as in the case with the sarcoma known as gastrointestinal stromal tumor, or GIST, the DNA and the mutations in the DNA of the tumor can give us clues as to important new molecular treatments that may be developed to fight that type of sarcoma. When a patient or family member is diagnosed with a sarcoma, there are many decisions to be made very quickly. The national guidelines from the National Comprehensive Cancer Center Network strongly encourage patients to seek an expert opinion at a sarcoma center or a center where the physicians there work as a team and have extensive experience in the management of patients with multiple kinds of sarcomas. The Dana-Farber Brigham and Women's Cancer Center, part of the Dana-Farber Harvard Cancer Center, has extensive experience in our hospitals, and we have an extensive team of multidisciplinary specialists, including medical oncology, surgical oncology, orthopedic oncology, pathology, reconstructive surgery, and many, many other specialties that work together in a coordinated team to help provide the best care for patients, whether it be using standard and conventional measures that local physicians could also deliver, or whether it be in the cutting-edge new research studies that are available at our center. We encourage patients to use this expertise here, and we work closely with other centers worldwide so that we can advance the care and the outcomes for patients with sarcomas so that they can be the best they can possibly be.
We're going to be talking about rare intermediate soft tissue tumors. The first one is dermatofibrosarcoma protuberans. It is a rare, slow-growing fibrohistiocytic neoplasm. A neoplasm is an abnormal rapid growth of tissue that underwent mutation. These can be benign or malignant, but they are usually malignant. Malignant is another word for cancerous. To treat, you use chemotherapy and radiotherapy, but these are generally not effective. The second type of sarcoma is a fibromatosis. It develops in connective tissue. It is cancerous, although considered benign because it does not spread throughout the body. 3 to 5% of all cases are considered cancerous. Cortisone injections and surgery are used, and when removed, they are able to grow back. The third type of sarcoma is a hemangioendothelioma. It is a vascular neoplasm and it can be benign or cancerous. It is caused by abnormal growth of blood vessel cells. Treatments include surgery, chemotherapy, and radiotherapy. The fourth type of sarcoma is infantile fibrosarcoma. It is present mostly in soft tissue or areas surrounding bone, and it is most commonly found in children under 1. It is treated with adjunctive therapy, which is chemotherapy or radiotherapy. Dermatofibrosarcoma affects only 1,000 people in the United States each year. 22,850 adults expected to be diagnosed with hemangioendothelioma each year, and 3,300 people of all ages are diagnosed with infantile fibrosarcoma each year. In 1 year, it is depicted 1,490 deaths will be caused.